Diabetes mellitus has several categories including type 1, type 2, maturity onset diabetes of the young, gestational diabetes, etc. The most common are type 1 and type 2 diabetes. In a healthy body, beta cells functioning is proper. Insulin is producing from pancreas without any complications. An insulin receptor accepting insulin and capture all the glucose from the bloodstream and store in cells for energy, and rest is stored in liver and adipose tissue as glycogen or fat. In type 1 diabetes, insulin producing cells of the pancreas are permanently destroyed. Only about 10% of all people with diabetes have type 1 disease. It's an autoimmune disease, insulin dependent. It is mostly begin in childhood or young age. It's caused by a genetic predisposition. It could be the result of faulty beta cells in the pancreas responsible of producing insulin. Type 2 diabetes is 90% of all diabetes cases. In type 2 diabetes, the pancreas continues to produce insulin, sometimes even at higher than normal levels. However, the body develops resistance to the effects of insulin. About 27% of people older than 65 have type 2 diabetes. Type 2 diabetes also tend to run in families. Obesity is the chief risk factor for developing type 2 diabetes, and 80 to 90% of people with this disorder are overweight or obese because obesity causes insulin resistance. Obese people need very large amounts of insulin to maintain normal blood glucose levels. Beta cells producing insulin properly, but the receptors are not accepting it. This leads towards the elevation of blood sugar levels. Insulin resistance, where the body doesn't fully respond to insulin.